So Achilles tendinopathy usually diagnosed, and it is back to the basic and from medical school's years, and then we need to have very good physical examination and also the history, because the patient will tell you that the pain is around the Achilles tendon region, and actually the Achilles tendinopathy can be further subdivided into two other types. The one is called the insertional type. Insertional, that means that this is the model which showing the Achilles tendon. So Achilles tendon, which is at the high heel parts. So the blue color, this structure is the tendon. So when the problem, which when the tendon insert into the bone, when there's a pain, so we call this is the insertional tendinopathy. And however, another part of the patient, they will have the pain which is not at the insertion, which is most commonly is between 2 cm to 6 cm above the insertion. That part is called non-insertional. Non-insertional part of Achilles tendinopathy is more common. So it's about 2/3 of the total people have the tendinopathy. The other 1/3 is from the insertional tendinopathy. So from the history, people will tell you that when the pain is, whether it is at the non-insertional part or it is in the insertional part. And secondly, most of the Achilles tendinopathy, they are related to the walking exercise or sport activity. So once they do started to do the sport activity, they will have the pain there. And from the physical examination, sometimes that there will be a focal swelling around the tendons, and secondly, when you touch on the tendon, they will have the significant pain. So some people will also have a very prominent bone there, and which is quite different from two feet if only one side have the symptoms. And so besides the physical examination and history, we have some imaging technique to diagnose of that. And the most simple way is the X-ray, because X-ray sometimes we can see that whether there's any calcification along the inside the tendon, or where the calcification which is at the insertional site. And they will also give the diagnosis. And furthermore, the MRI will be a more useful technique to diagnose, and especially an MRI is very good to detect the soft tissue problems. And we can look at the tendon to see whether there's any rupture of the tendon, and also at the same time we can see whether there's any inflammation surrounding the tendon.